all for our second day of Indian Institute of Homeopathic Physicians National Seminar. Respected chairperson of this session, with the blessings from our master, Dr. Christian Frederick Samuel Hanneman, who gave us a beautiful science, which gave us name, fame, money, everything. Thank you, sir. Today, the topic which I am going to discuss is something different, because we have been hearing yesterday so much of topics with homeopathic therapeutics, repertory selection, and rubrics. Today it is different because it's related with the research topic which I did in my PhD course. Years and years, we have been facing a major issue. Even though our system of medicine is well proven and solid science, it has been severely criticized and ridiculed by the medical doctors or community or scientific community, as there is no credible proof to prove that our system of medicine works beyond placebo. The medical community and scientific community, they need rigorous and reliable scientific evidence to trust any system of medicine, including our system of medicine. So, some possible ways which we can go with that one is, where we know that now the world is going to evidence-based research. In that one, we are having one pyramid, where systemic review and meta-analysis is on the top plane, followed by randomized control trials, which is the gold standard in clinical medicine. We can perform systemic reviews and meta-analysis of existing RCTs. This is which the young generation has to take up, because there are several researchers which has done. It has to be reviewed, analyzed properly, and you just see that if there is any heterogeneity or any biases there. Followed by randomized control trial, which is the best proof in clinical medicine, which has to be done through high quality placebo control trials, which with our practice of what the principles and practice of homeopathic system of medicine is there, which has to be included in that one. And the challenges which we are facing in our homeopathic research. The first challenge which is there is the funding and resource related. For a clinical research, especially for a randomized control trial, we need so much of money, which an individual cannot take it. We are not having enough pharmaceutical companies to fund it. So, we find difficult, because in Ayurveda and modern medicine, there are several pharmaceutical companies who are giving funds. And another thing, which is individualized treatment. When I went for the screening committee, the ICMR person, they told it's not possible for you to go with individualized treatment, because we don't have a specific medicine for a specific condition, which is very difficult for us. And we don't have a global guidelines. We have to follow the guidelines which is there in the ICMR. So I went for this individualized this one, but they are not allowing us to go. Then we come up with the single medicine, but fortunately we got a very good result. And the topic is immunomodulatory effect of Arsenicum album in patients, in children with wheeze, with the cytokine analysis. This is the research which I have done. And why pediatrics are important for us? You know, people believe homeopathic system of medicine as a safe medicine. So they will bring children for their treatment, and also it is very easy to administer. So we have to, all of you have to be very much practically oriented in all the examination of the lungs, liver, glands, all adventitious sounds, then only we could able to come up. And the challenges in pediatric case taking. Interpretation is very less. No? We cannot interpret, because the mothers will come, they will tell the symptoms in exaggerated form. So we cannot rely on that one. Second one is the attitude of the physician is very important because we have to give maximum importance to the spontaneity of the expression of the mother. Along with that one, we have to see what all things are there. I have to stay here. Okay. I have to change the slide. That's the problem. Okay. Then this is knowledge of embryology. Yesterday, Dr. Praveen Jain has been telling about the embryological development. It is very important and the stages of development in the child, because if the normal developmental stages are not known clearly, the parents are in concern. So they will give unnecessary medications also. These are the challenges, and you should have clear-cut observation skills. Our Guru, Dr. Praful Vijayega told, we cannot, if your mind is not perceiving correctly, we cannot see it clearly. And whatever you are hearing with your eyes, with your ears, it will be lie. The mothers will tell lie, but you have to see the truth which is there through the eyes. So the observation skill should be very clear, like an eagle's eye. Coming back to the pediatric overview, everybody knows this one. Whenever the lungs and airways become easily inflamed with certain, whenever it's exposed to some allergens, it will be inflamed. As a result of which, there will be so much of clinical condition. I am not taking too much of time in all these things. And it is a chronic inflammatory disease, always characterized by hyper-responsiveness of the airway. Infiltration of eosinophils will be there. Along with that, there will be obstruction of the airflow. It can be reversible. Remodeling of the airway and global cell hyperplasia, and as a result of which mucus hypersecretion will be there. Usually this wheezing will be triggered by upper respiratory tract infections like rhinovirus, respiratory syncytial virus. Along with, after that, it is associated with high degree of inflammation. Inflammation is the hallmark of any disease condition. And it's for the students, what is the function of respiration? Why respiration is there in our body? What's the function of respiration? Sorry? Which organ develops first in embryology? At which weak heartbeat gets? Sorry? Tell loudly. 41st day. But fortunately, respiratory bud is the one which is coming first, which is on the 3rd week of pregnancy. In the embryological 3rd week, respiratory bud comes and it becomes an organ by 10 weeks, and the respiratory system will fully mature at the end of the intrauterine life, isn't it? But below at the 3rd week, respiratory bud will be there. Below the respiratory bud, there will be cardiac node, but it grows faster than that of the respiratory bud. As a result of which, within 4 or 5 weeks itself, you will get the heartbeat. But respiratory growth will be there only at the end of the intrauterine life. Okay? This respiratory bud develops into, first it changes into alveolar capillaries. Alveolar tissue forms after this one, followed by capillary, where venous circulation and mucus will be coming. And function of the venous circulation and this mucus is to filter whatever there is inside the body. So the air filling mechanism of the lungs is from below upwards, because the lung develops from below upwards. First, respiratory bud will be there. After the respiratory bud, there will be splanchnic mesoderm, which develops into alveolar tissue. Then the other tracheal, bronchi and other things will be coming. So whenever you are having any respiratory conditions, we will have this mucus secretion or crepitations, everything on the lower side only, even if it is pneumonia, TB, because of this condition. So whenever any particles enters, toxins enters the body is trying to defend it through various mechanisms. That one mechanism is cough. So cough is a defense mechanism which is vital for our body. So you are not supposed to give medicines immediately. Let the child cough, because while coughing, the child has to take a deep breath. Then only they can push out the toxin. So that along with the body, the lungs also will grow. Till what age lungs grow? Students, till what age lungs grow? Till the age of 14 years, the lungs grow. Okay? Whenever you breathe in, what is the volume of what all things are entering? Nitrogen, oxygen, and other gases. How much will be the nitrogen? Sorry? 78% of nitrogen, 21% of oxygen, and 1% of other gas. Nitrogen along with the oxygen, nitrous oxide is a piercing effect. It will go inside. Okay? And the other gases will be going out as carbon dioxide. In cases of asthma, whenever the mucus is there and it gets stagnated, it is called asthma. The pathophysiology of asthma, it is only for us, not for allopathic doctors, because bronchioles are condensed. There are two types of bronchioles, inspiratory bronchioles and expiratory bronchioles. Inspiratory bronchioles will be for the inspiration. Okay? So whenever condensation of the bronchioles is the basic reason for everything. Condensation. Bronchioles get congested. Okay? How it gets congested? Whenever it's a GNM give you the answer for that one. Whenever a person is in fright, fear, anxiety, we will take more air, isn't it? So more nitrogen, more gases are taking in. As a result of which, nitrogen, oxygen which is there, that will be pushed to the heart. The nitrogen and other gases will be coming out. So whenever this nitrogen will be more, all over the mucous membrane, its mucous membrane is salty taste, isn't it? Sodium is there inside the mucous membrane. Sodium mingles with nitrogen, causing nitric oxide, which is corrosive, gelatinous, and thick. That will condense the bronchioles of the inspiratory tract, which causes inspirational asthma, which is unnoticed, which cannot be easily diagnosed. Okay? The patient will be walking, doing everything, but it is unnoticed. Whenever this patient, this is called functional asthma. It is the first stage of asthma, where we have to go with the plant remedies in cases of inspirational asthma. Like, whenever a patient is having fear, anxiety, what will be the medicine first comes in your mind? Aconite, plant remedy. Then followed by, if it is a continuous fright, opium. Because it is the mechanism which is there. Neurocompression of the brain causes this bronchioles to get condensed. See how mathematically it is there. Depending upon the cause, the medicines change. Yesterday, Dr. Rajendran has been explaining all these things. All the plant remedies like opium, ignatia, anxiety with grief, ignatia can come. Isn't it? Lycopodium, pulsatilla, and even Nexomica also can come in this condition. So, it enters. It is called acidic. What is the pH of mucus in the respiratory tract? Whether it is acid or alkaline? Acid. It has to be alkaline. Then only it can come out. The pH has to be, it comes to 7. Above 7. So, it has gone in, enters the capillaries, and it has to come out. While coming out, there will be little bit difficult, because carbons are difficult to push. So the moment the patient is having difficulty, what will happen? The carbon pushing will be difficult, so that the patient will have heavy breathing, exertional dyspnea, which is little bit more dangerous than that of inspirational asthma. Got it? Inspirational asthma. And the patient will breathe through the mouth open. There will be foam in the mouth. Continuous irritation of the nasopharyngeal will lead to adenoid enlargement. And if this child is continuously taking some medications, Then it will go to the sinuses also. How many sinuses are there? How many sinuses? What all? Okay. So whenever there will be difficulty in pushing another thing, the patient will be opening the mouth, breathing difficulty will be there. Then we have to consider medicines from mineral kingdom, like all kalis except kaliars, silesia, phosphorus, bromium. All these medicines will come whenever this also is not that much difficult for the patient to breathe. Whenever we check, then only we could able to find that the patient is having little bit aspirational asthma. And if it is both inspiration and aspirational asthma, there comes the difficulty. The patient will be difficulty in sleeping, lying down, because both the condition the patient will be difficult. Whenever they lie down, that will compress the chest so that they won't get enough sleep. They cannot able to, so they will sit. All medicines coming is arsenicum album, first medicine. Thaliars, natronamase, arciodate, okay, Singam metallicum, and even plant remedies which is like minerals. Naxomica, conium, chamomilla, all these medicines will come. This is just for your information. So, I took arsenicum album as my project because of all these conditions. Because arsenicum album will work in all the conditions. Even if it is in the first stage, we can give, but if you are giving unnecessarily, that will give you suppressions. Does homeopathic medicines have suppression? Homeopathic medicines will make suppression? Yes. Diagnosis of childhood. Whenever you have to diagnose a child with asthma, the child will have coughing, especially at night, which I told you. There will be whistling sound and breathing out will be difficult, and trouble breathing or fast breathing will be there. Current status, I am not going details of that one. In age group also I am not going. Different months. These are the 3 months which is very important for the people who is having increased asthmatic stages. Patient reported triggering factors in asthma. Dust, pollen, so much of things are right. Ice, drinks, everything is there. Then current treatment approaches. In allopathic system of medicine, these are the treatment options which is there in them. Limitations and challenges. We cannot give medications like that of in children like that of adults. That is one thing in allopathy, don't us. Severe episodes during my PhD also, some cases was having acute exacerbation which has been taken care by the hospital college itself with other medications, so that I have deleted that patient from my this one. Then arsenicum and asthma. Everybody knows about this one. Arsenicum album is very effective for all the, and it has been a very main medicine for even in the COVID conditions. Because whenever the patient COVID also, what happens? The patients were in a stage of fear. What will happen to me if I get it? So the lungs are weak. Whomever is having so much of fear, it is not because of the, now also COVID is there, but the patients are not in a stage of fear. The rationale behind my study is homeopathic medicines acts by stimulating the body's defense mechanism. No studies have done so far to link between the action of homeopathic medicines and the immune system by quantifying cytokines, which is very important. Homeopathic mode of treatment is the right choice to treat respiratory tract infection in children with these. So far, homeopathy has been proved effective for the management of upper respiratory tract infections or recurrent respiratory tract infections in children with these. However, it is important to show scientifically that our medicines act by improving the defense mechanism. This is the rationale behind my study. Everybody might be knowing about cytokines, which was the basic reason for all the problems when the COVID was there. I am not going into the details of all these things. Why I chosen this one, interleukin 1 and TNF alpha for my study. Immune system creates inflammation whenever the body is having some infection, injury or disease. So what is the inflammation? Inflammation is the hallmark and it is the defense mechanism of the body, which is very vital for our health. This inflammatory response is the coordinated activation of all the signaling pathways, including all the cytokines. Okay? And cytokines are predominantly released from the immune cells like macrophages, lymphocytes, and monocytes. There are two types of cytokines. One is pro-inflammatory and second one is anti-inflammatory. Pro-inflammatory, as the name suggests, is promotes inflammation, and anti-inflammatory, it limits or inhibits inflammation. You just see this in the black color, it is pro-inflammatory cytokines. Interleukin 1, interleukin 6, interleukin 11, 17, TNF alpha, and these are the pro-inflammatory. Along with this pro-inflammatory cytokines, if it is an acute inflammation, then interleukin 8, 16, and growth colony stimulating factor will be there. If it is a chronic one, then the other condition. So, all these cytokines are working in balancing way so that the body will be defended from inflammation. Okay. The role of TNF alpha and interleukin 1 in pulmonary pathophysiology. So, increased inflammatory cytokines and chemokines contribute to the infiltration of inflammatory cells and remodeling of the airways in the pulmonary epithelium. A study analyzed these molecules in bronchoalveolar lavage fluid. In 1917, one study was there which found that people who are having more pro-inflammatory cytokines like interleukin 1 and TNF alpha will have severe to moderate asthmatic attack, which comparable to people who are having interleukin 6 and interleukin 17. Another thing is sequestration of polymorphonuclear leukocytes within the lungs is the basic reason for all acute and chronic pulmonary diseases. And this recruitment of these cells to the alveolar capillary wall occurs via the ability of another interleukin, that is called interleukin 8. I already told you that interleukin 8. It will, whenever the TNF alpha and interleukin 1 will be more in the bronchoalveolar fluid, they will have A49 epithelial cells, because gene expression of interleukin 8 from pulmonary type epithelial cells. Everybody knows pulmonary type epithelial cells is the basic one which causes acute respiratory distress syndrome. So whenever this interleukin 1 and TNF alpha will be there in their fluid, then they are prone to have acute respiratory distress syndrome. So I took these two parameters as my study. An aim and objective, that is to evaluate the effectiveness of arsenicum album in terms of reduction in cytokines like interleukin 1 and asthma, reduce the episodes of wheeze attacks and reduction in the severity of the wheeze, and even the quality of life also has been examined. Material, it is a two-armed randomized control study. This is single blinded control study. Age population was from 2 to 5 years and study duration was 1 year. 102 patients has been recruited, 51 in both arms. One is placebo arm and the other one is arsenicum album arm. That cases has been recruited from the Sharada Krishna Homeopathic Medical College OP, and we have taken some camps outside the college also. Altogether 102 samples has been taken. And this sample, one thing is my college was having a very NABH accredited lab, but the kit which I have purchased cannot able to run in that particular lab. It was a good thing for me because, so I approached Rajiv Gandhi Institute of everybody knows that institute now. It is a central government institute where I approached them and they are ready. All the there are several scientists we are ready to help us. So they took my samples and they processed there, and there also one Dr. Santosh Kumar was there who was helping me in my research. Fortunately, by the end of the study, this Sharada Krishna Homeopathic Medical College has been come up with an MOU with Rajiv Gandhi Institute, so that I don't want to pay extra for the lab which I have been used for the Rajiv Gandhi Institute. And this result gives authenticity, isn't it? More than the results which we are getting in the homeopathic medical colleges. And the tools which I have used is infant and older quality of life scale, was that everybody knows is a pain scale, but that also I have taken for my study, and this sample size is depending upon the severity that changes. Sample size estimation was this, inclusion criteria, exclusion criteria, everything was there. I am not going because the time is limited. And study finding will be the improvement in the terms of reduction in the frequency, duration and severity of each episode in the intervention arm and comparable to the placebo arm. Then there's interleukin and this one. That baseline characteristics of 102 patients. Baseline characteristics is a parameter measured in the participant at the beginning of the study, so that before any treatment has been given. So we can make sure that this can be these results can be comparable. These are the baseline characteristics. And distribution based on gender. Equality should be there. In my case, 46 males and 56 girls has been selected for my study. Then comes the distribution based on the age. I already told you 2 to 5 years. You see, maximum comes under 3 to 5 years. Then distribution based on family history. If the parents are having, of course, allergic condition is having a strong family history also. If both the parents are having allergic history, then the chances for getting allergic condition in the children is more. That you can see in this group also. Non-intervention, the blue line indicates the intervention group. Then past history. Children who are having repeated attack of cold, cough, rhinitis or bronchitis will be more prone to repeated attack of cold and this asthmatic attack. Birth weight. 2.5 is the normal birth weight, isn't it? Below 2.5, it is low birth weight. So, the infants who are under 2.5 kg are more prone because their respiratory tract has not yet been finally matured. Before that it comes. So, they are prone to asthmatic. In my case, 57 cases was below 2.5, below 333 and above 312 cases. ESR. Dr. ESR is a non-specific indicator of inflammation in the body. Elevated ESR level can be an indication of an inflammation. But in case of pediatric asthma, it has not been a direct connection with the asthma itself. There might be some other inflammatory condition also.
5 minutes more.
Okay, I am finishing. In this group, ESR was found reduced in few cases in the intervention group, and even in the non-intervention group also some cases has been reduced. So it has not been considered as an important factor in my study. And in AEC, eosinophils, it's a white blood cell count. AEC has been reduced in almost 86% of cases comparable to intervention group and non-intervention group. And VAS intensity, this visual analog score is used for the intense severity. It has been decreasing from pain 7, 8 to down during the treatment, but in non-intervention it is not that much decreasing. Then concentration of that's a basic one. Interleukins, it's a group of protein cytokines that play an important role in the immune mechanism. More than 27 cases has been reduced with our medication, and in non-intervention group you can see only one case has reduced, the rest all has increased, which increases the authenticity of my study. Second one, concentration of alpha levels, that also in 12 cases it has been increased with our medication. Some cases, even in the Rajiv Gandhi Institute, these people are telling every cases we won't get the result because there must be less sample, or the samples which has been processed for a long time also might have damaged this one. So the TNF alpha was clinically reduced in many cases. Then comparison of the mean values along with this TNF alpha and other things, complete blood picture and other thing has been checked, and it has been found that other parameters also has been reduced. That our treatment is effective in reducing other parameters also. You see that ITQL, quality of life score, the trend line shows that it is going up. That means the quality of life has been improved. In the non-intervention group, the trend line is not exponential, which shows that our medicines are effective in giving this one. Comparison of episodes before and after. You just see considerable reduction is there in the people who are having medicine intervention group, and there was not that much of reduction in the patients having that statistical interpretation. When the blood parameters including this interleukin 1 and TNF alpha has been analyzed, in the intervention group, the mean difference is very high. It has been clearly written. And the 95% confidence intervals when we checked, it also found beneficial, which is qualified by reference to the statistical significance to below p-value. It should be 0.005, which gives authenticity to my study. So, with conclusion, the study demonstrated the beneficial effect of arsenicum trioxide in reducing pro-inflammatory cytokines like TNF alpha and interleukin 1, indicating the effectiveness of homeopathic treatment in mitigating pediatric asthma. So even though we are going with a single medicine, we could able to get a very good result, that too with the lab from Central Government Institute. This is the study which I did. I am going for the exam soon. I hope this will help that. Thank you for your patient listening. Thank you very much.
Thank you. Thank you, Dr. Santosh.
Presentation is very good. The research aspect,
Thank you.
because most of the students are waiting for the, I think so, some evidence base.
Yes.
You have given the entire research aspect and these blood samples taken and improved. So no doubt arsenicum is a remedy for asthmatic attacks, even children to the adults. But my question is, have you taken the out of 102 sample size, how many X-rays you have taken before and after?
How many?
How many X-ray films of the chest of the pediatrics you have taken or not? Only blood samples you have taken are presenting here.
Yes. I have, because from Sharada Krishna Homeopathic Medical College, I won't get that much of patients. So, the laboratory examination was difficult. Very few X-rays we have taken.
Sir, in this aspect, we have to show to the evidence to the other medical profession. The changes in the X-ray we have to see and we have to produce before the.
Yes, of course.
That is most important, sir.
That is there.
So what is the research is going on in the entire India, all research institutes, we have to show like that. Unless they cannot assimilate, digest our presentations. That is my request, sir.
Okay.
Humble request.
Yes. We have, I already explained, sir. I already explained that we have taken most of the cases from medical camps where this facility was not there. We are taking the lab people along with us. So blood sample was the only one which we have taken. That is the difficult. And even while doing this research, so much of difficulty was there, sir. The sample size, to get that 102 sample size, it was difficult. The moment the people
Yes,
are
sir.
taking.
At least 30 is accepted.
Yeah,
Yes,
but for
30 is
my-
accepted internationally. So we have to show at least the X-rays before and after treatment.
Yes, sample size estimation is there. It is not possible for us to take that one.
Yeah.
That estimation rule is there, that has to be followed
Yeah.
for all the research. So while doing that statistical analysis, we have to go with 51 cases. So
Okay, sir.
102 cases has to be there. So that cases has been taken from most of the camps.
So it
itself.
is randomized or non-randomized, sir, you have done?
Randomized.
Randomized.
Yes,
So
single blinded study.
Okay, sir.
Okay.
Thank you.
Any other questions?
Thank you. Thank you, sir. Thank you so much.
Yes, we have taken care of them. The college has taken care of.
Thank you. Thank you, Dr. Santosh. Please.
To felicitate Dr. Santosh, I invite Dr. Har Prakash Sharma, Advisor, IIHP National, Dr. Harish Dhaurat, Advisor, IIHP National, and also Dr. Sudhanshu Arya, Secretary General, IIHP National. I request all three doctors to come onto the dais to felicitate Dr. Santosh. I request Dr. Sudhanshu Arya sir. I request Dr. Sudhanshu Arya sir to come onto the dais. To come onto the dais. And I also request Dr. Dole sir, Principal, Jim's Homeopathic Medical College, to come to the dais. I request Dr. V.K. Gupta sir to come onto the dais to felicitate Dr. Naveen Pavaskar and Dr. Dole. Please give a big round of applause, because they are the main sponsors for our national seminar. We should appreciate and give big round of applause. Please give them big hand. Thank you very much, sir, for your support for the good cause, because this is a seminar for students. Thank you so much for everything. Dr. Dole sir. Thank you, sir. I am very delighted to invite my teacher, Professor Dr. Shashikant Tiwari sir, to come onto the dais. As many homeopathic practitioners and students know him for his famous book of Essentials of Repertorization. So everybody knows him, including myself. I am the one of the fan of sir. I am very delighted to invite him. And he started his career as a professor and principal of Father Muller College, Mangalore. And later he was served as director, National Institute of Homeopathy, Kolkata. And he was the examiner, paper setter, PhD guide to various universities of India. And he is actively involved in many research activities in CCRH. And he was awarded by many organizations in India and abroad. And recently he was awarded Dr. By DK Karnataka Rajasya Award by Government of Karnataka. So we welcome you, sir. Big him give. So it's a great honor to listen him. Thank you very much.
I am very delighted by your greetings, by so much claps, and thank you very much for acknowledging my presence. I am going to present something about repertory. Yesterday I heard somebody had presented already about repertory as to how to select and which repertory should be selected as per the case. In the beginning only I should tell you, selection of repertory is not the right of physician. It is always governed by the case. Because when we take the case, every case has different dimension. You may be having a short case with few symptoms. You may be having a very detailed case with a life history, past history, and lot of things in the life space is had different dimension. You may have a case where only some organs, some pathology, some modalities, only those things are available. Then this case needs a different type of analysis and repertorization. So what I am telling is each case is different and each case has to dealt by different type of methodology. But our approach is what? To see the totality and match this totality with the right medicine so that the right result comes. In all aspects, whole homeopathy is governed by the principles of similia similibus curantur. Remember this principle when you are taking the case, when you are prescribing the case, when you are doing the follow-ups, even antidotes, complementary medicines, all are based on similarity. Boger's methodology and application of Boger's method. See, nowadays we don't limit to one book, but we follow the methodology. Like Kent methodology, if you know, you can have synthesis, you can do with complete repertory, you can do with any type of all advanced repertory which are based on the Kent's repertory. Boninghausen methodology is applied in Boninghausen therapeutic pocketbook, BBCR, and even some of the radar softwares also synthesis book. So method is one, but it is not limited to one book. So we are going to understand Boger's methodology with the help of BBCR, no doubt, but it can be applied with any other book and software also. So now we are going to understand the methodologies, which is very important. Here it is not coming. Okay, no problem. So, you know the answer, what is repertory? I'm not going to discuss. Repertory, in short, if you say, it's a device to help you to come to a totality and match the picture by repertorization to come to a similimum. So, in short, it's a device to find out similimum in a logical, systematic way of working out a case. So repertory, don't be so much afraid of, repertory is a very easy subject. Every definition is easy and every method is easy. So repertory is a device to find similimum. That's all. And how it is done, by indexing, by arranging, that is all details. BBCR is Boninghausen and Boger characteristic repertory. And how does it help, we will see. These are the stalwarts of whole repertory. These are the pillars, you can say. Hahnemann conceived the idea. Boninghausen executed the idea. He published the first antipsoric book. And the last one was Boger. The side is the Nur and Kent's. So these all are methodologies. So it started with the Hahnemann itself. Our master had the idea of repertorization. And Boninghausen died in 1864. Boger was born in 1861. So they have never met. Some people say that, Boger was a very close disciple of Boninghausen and they have worked together. No. Boger was only 7 years old when Boninghausen died. So this you must remember. But he followed the principle of Boninghausen. Boger started a few things about Boger you must know. Boger started his medical career through clinical practice at the age of 27 years. This was the time when contributions from many stalwarts of homeopathy made homeopathy very popular and appealing to the public. This new system of healing out was preferred system of medicine because of its ability. So those era was very famous for homeopathy all over the world. Even United States, it was the first line of treatment. But by this time there were variations in methodology, in prescribing, which created a confusion, which helped Kent to come out with a highly philosophical method of understanding disease by understanding inner man. He came out with this philosophy. His explanation and deliberation of homeopathic principles attracted a large number of homeopathic students, and thus a new era in homeopathy was perceived. Boger, while practicing homeopathy, made a thorough study and used Boninghausen's repertory, Jahar's repertory, Possard's repertory, Wells repertory, Kent repertory. because he has used even Kent's repertory. Remember, Boger has written a book, Additions to Kent Repertory. 3,200 corrections he has done. So don't think that Boger has not gone through Kent's repertory. He was very well aware of Kent methodology, but he suggested a lot of practical methodology, which I feel is very relevant now. During his long career in medical practice and research, Dr. Boger contributed a lot by his writings, successful treatment of incurable cases. It is said that patient reported to him from various parts of USA because of his ability to prescribe right medicines even in incurable cases marked with common symptoms. His method of finding out a remedy through analysis and synthesis and construction of repertory, writing several other books, and lively translation of several medical books from notable German authors has made him a renowned author and physician. And he has proved some kind of medicine also. This is little important. I will just go through this. Bogus view on understanding diseases. How well a physician can understand disease by taking care of what all things during case taking and after case taking. This is what he is telling in general picture should be given more importance compared to keynotes. Objective symptoms are more reliable and concrete because he has told that subjective symptoms depend on the interpretation of the patient and it cannot be relied on because it cannot be confirmed. So objective symptoms comparatively are more important. Last symptom is the most important clue to the simillimum. Here it may not be amiss to the point out that nature tries to attract our attention to the most important things by developing them last of all. So nature has a mechanism to take your attention and attraction. He creates best thing in the last. By this way, the best symptom, this is only giving a example or narration, the most important symptoms appears to the last. In all disease pathology, if you see this symptom has appeared last, like he has given an example of a case where the last symptom appeared as a coating of tongue. And he prescribed on that and the patient was cured. It was a very incurable case. So remember bogus one indication, one clue that the last symptom which has come as very prominent in the case, give importance to that also. In confusing presentation, prescribe for the most recent phase because a patient may come, he has diabetes, he has blood pressure, he has kidney failure, he has the heart symptom and now he is coming with a stomach upset. So go one by one and see the last symptom, last phase, the last phase of totality has to be taken care first, give importance, prescribe, then go slowly and catch the whole person at the last. Every symptoms has three phases, constitutional, general and the peculiarities. About case taking, he has given few clues which is very important. First, try to elicit the cause and course of symptoms. So what he says is, cause is the most important thing. So give importance and try to elicit the cause. Second, what he is telling is modalities. Considering of mental state in order of importance. So modalities and the causation and modalities includes physical and mental both. Third thing is entire objective aspect of expression. including the state of secretion. Lastly, the part affected must be determined, which also brings the investigations in touch with diagnosis. So this four things: cause, modalities, objective symptoms, expressions, and the part affected. If this you have, you be sure that you can prescribe a right medicine. But if you don't have modalities, no cause. Don't have a cause, less chance. I mean, the chances becomes less and less. If you have only locations and modalities, since four of things are not attended, chances will be 75%. And any of these four factors can become a differentiating and deciding factor for the medicine. Philosophical method. He says that complete symptoms and concomitants are most important. So try to take a case and find out location, sensation, modalities, and concomitant. This way of going also will help you to come to the totality. Because see, what we are trying to get is totality. Second, what is telling? Doctrine of pathological generals. If you can find out a common pathology, see, it is not one pathology we are giving importance in Boger method. This is a very confusing statement by many of the people. Boger has given importance to pathology. No, pathological generals. Like a degeneration pathology is giving the patient, inflammatory pathology, common discharges, common blood disorders, common tendencies. These are pathological generals. Tendency to pus formation, small cuts, this is pathological general. Tendency to bleed easily is a pathological general. This tells about the whole person's pathological behavior of the person. So this is important because this is a general symptom of pathology. Doctrine of causation and time. Then clinical rubrics also is given importance. Where to apply is when there are no other things which are prominent. So in those cases also, bogus methodology can be used. Fever totality, he has given a different kind of totality, and by that you can treat any kind of fever. And then we have methods of repertorization. Based on this philosophy, there are 7 methods of repertorization. And if you can use these methods, you can treat any kind of cases. Even in your practice, even if your exam, this will be important. First is using causative modality. If you have causative modalities, means cause has increased, cause has brought this disease. If you have in a case, give importance. Modalities at the first place. General modalities also if you have concomitants very strong, if you have pathological generals, if you have diagnostic rubric with modalities, if you have complete symptom, and if you have fever, you can use Boger's method. We'll come to the cases because there are 7 cases and 7 methodologies. This is a case of girl, 13 years old girl who came with a lot of pains here and there. And leg pain, knee pain, see, and then another thing is frequent cold and cough, nose block, better by sun. Patient was staying at Madikeri, it's a very cold place, and she was going to the school. Often she used to be nervous in the school when she was asked to stand and answer. Slowly she started getting back pain while standing long in the school. Next to that she started hand pain, and then parents took her to a since mother was also a rheumatoid arthritis patient, mother took her to a doctor and she was diagnosed as rheumatoid arthritis. So after rheumatoid arthritis was diagnosed, she was given painkillers, she was given steroids that relieved her symptoms. Then after some time she started again. Then she was taken to Ayurvedic treatment, but because she lost weight and a lot of restriction in the food, they did not like, then they came for homeopathic treatment. And this was the result. ESR is 25 and RF factor is positive, it is 24. CRP also is increased. So it is a diagnosed case of rheumatoid arthritis. Physically, she is a thin look, chilly, sweating in the palm and feet, white dots on the nail, likes pastries, cake, constipated before and during menses. She has a lot of anxieties, feels like hitting herself. Anxiety increases and it is causing her symptoms very often. Father and mother had this type of history. So totality we have taken is emotions aggravate is a causative modalities. And under emotion, in BBC there are rubrics like anxiety, fear aggravates, mental exertion aggravates, physical exertion aggravates. So we have taken causative modalities as a first, then we have taken modalities general, then we have taken constipation as concomitant. And then repertorization, Nux vomica is coming as a first medicine, Silesia is coming second, and Pulsatilla is coming third medicine. So we have differentiated with the help of PDF. She is a chilly patient, ameliorated by sun and white dots on the nails. Because she never used to get angry, Nux vomica is ruled out. And she is chilly patient, better by sun, is found only in Silesia. Also white dots, Silesia is one of the symptoms. So she was prescribed Silesia and she was requested to come after 1 month with investigation. Her RF factor has become 8.8 and her ESR has become 17. So this is a cured case of rheumatoid arthritis with the help of Boger's first method, causative modalities with concomitants and general modalities. Here we had a case where modalities were very prominent, and this is a case of mitral wall prolapsed. Master 80, 10 years old, reported with echocardiogram. They come with the investigation most of the time, so we don't have to waste our time for investigation. Also, they come with all this report when they know that there are no other treatments available. So you can see whatever symptoms are required and you can go ahead with your way of treatment. The cardiologist has suggested to parents wait and watch, and with a lot of restriction, child should not move, child should not go upstairs, and then go for a major operation, valve treatment. This is the report, mitral valve prolapsed and trivial MR. So with this report, patient has come. So we have taken the case, breathlessness, pressure, constriction, feeling at times in the chest, aggravation running during games period in the school, must sit down in between while climbing stairs, palpitation at times after exertion, before food, when stomach is empty, these are aggravations, occasional pain between the scapulas, bad smell from the mouth, aggravation in the morning, dryness of tongue, aggravation in the night, cannot tolerate hunger, aggravates all the complaints. Some more symptoms, well built, increase of fat around the abdomen, desires chocolate, cheese, salt, sweet, aversion to meat, eating beans, taking of the milk, aggravates, appetite, feels too much hunger at times, occasional, eats much and suffer from diarrhea. He eats too much and then goes to diarrhea. Writing notes increases her problem. Homework causes increase of suffocation and feels tightness in the chest. Perspires easily, any small work makes him sweaty. Breathlessness, likes hot weather. Sleep good. Writing is difficult. Now go to the. Now these are the main totality symptoms available. General, here what we have got is pathology, no doubt, symptoms of common symptoms of disease we have got, like breathlessness, cannot run. These are common symptoms of wall problem. But what we got characteristic is most of the modalities. Ascending aggravates, milk aggravates, awaking when aggravates, writing aggravates, legumes, bean aggravates, hunger aggravates. Hunger aggravates is a general aggravation as well as a concomitant. Heart, reason of, we have taken as a location. This is there in the BBCR. Heart, reason of constriction, contraction, this is location and sensation. So we have taken location, we have taken location, sensation. Also heart, reason, sound abnormal. This is a rubric given in BBCR. Very, very good rubrics are given, and some of the times you will find these rubrics are never given in any other repertories. So abnormal sound we have taken as location and sensation. So what we have got in this case is general aggravations, general modalities, concomitant, location and sensations. So we have given for the Boger repertory. And what is coming is Kali Kaap, Calcarea Kaap. See, there was little tough time to differentiate between Kali Kaap and Calcarea Kaap. But we found Kali Kaap covers all the lower symptoms, like heart sound murmur is given Kali Kaap. Location, heart, more action is there in Kali Kaap. And some of the modalities like hunger is also found in Calcarea Kaap and Kali Kaap, but Kali Kaap is more. So we selected to give Kali Kaap. He was not very regular in treatment. He continued intermittently. Because of his complaints were better, last 3 months he was very regular in follow-ups. Total duration of the treatment took 1 year, and he was advised echocardiography, which was shown. Because the parents told that now he is able to do all the work. And even when we restrict him, he runs around. See, 11, 12 years boy, how much we can ask them to take rest? Children take rest when they are sick. They cannot sit down and be serious like we, because we are not child, no, we are not happy. That is why children are always happy, so they just go around. They will never sit down. They will never sit for a long time. But if they are sick only, they can sit down. So it was difficult for parents to restrict them. And then we said, okay, anyway now child is better, go for echocardiogram. An echocardiogram shows normal study. See, this is Boger. Boger methodology is a very, very practical methodology. All kind of cases we can put to the Boger. When causation was there, we took Boger. Also see, causation, the first method, I forgot to tell you, can be taken by any repertory. Even Kent repertory can be fit for the first method. Causation and result. But all other methodologies were be taken by BCR also, BBCR more, and the first method is by any repertory. So this was the modalities method. Then we had one case of chest pain. See, this is a concomitant method where we get one concomitant and see how we have come to the right medicine. 64 years. This is a very old case. This case was treated when I was in Father Muller's, and we used to treat patient by admitting and every day recording their interpretation. And we also had occasionally, if you want, visit by other doctors. So a cardiologist also was available if you need. So we had more confidence in treating any kind of cases. So this is one case where patient came with a left-sided chest pain. And these are the rubrics, case taking we have done. Location is left side chest, and constricting pain, pain as if something heavy is pressed, radiating type of pain. Modality is what? Aggravation, exertion, walking, lying down ameliorates. And headache is one great symptom with the patient. Whenever there is a chest pain, he was telling, or constricting feeling, he used to have headache. If this subsides, this also subsides. Very peculiar symptom. And these are general physical examination. Pallor absent, icterus absent, cyanosis absent. What is present is edema absent, temperature afebrile, BP is so much and RR is so much. Chest inspection, shape, barrel, no problem. Auscultation S1, S2 is heard, S3. Some abnormal sound can't be specified. So this is the acute totality we have taken. First important given is concomitant. Chest pain with headache and giddiness. See, there are chapters in BBCR you find how they are arranged. First part, if you see head, first part is location, then sensation, then you have aggravating factor, ameliorating factor, and concomitant. These are all separate chapters attached with each chapter. You have eye, you have all locations, then you have sensation, complaints, then you have modalities, then you have concomitants. Vertigo chapter, if you see, I think if you master vertigo chapter, you can be specialist of vertigo. And just write on your board, specialist of vertigo. But first master vertigo chapter. Specialist of menstrual trouble. Master that menstrual trouble chapter because it has concomitants before, at the start, during, after. No, nobody has so much clear cut given in repertories like Boger. So here concomitant was very strong. We have taken as concomitant, and this is given in BBCR repertory. So that second we have given modalities: chest pain better by lying on right side, then sensation constricting, then sensation pressure, then sensation radiating pain, and last sensation and pathology we have taken chest abnormal sound. Same rubric.
Dr. Tiwari, 5 minutes more.
How much time?
Thank you. 5 more minutes. 5 minutes.
5
more.
minutes. So this we have taken the case and we have come to this totality. Rubrics I have already told. And the medicine comes cactus, spigelia, phosphorus, nasa. But because of the concomitant we have given nasa. And then these are the sheets where we record the symptoms. ECG was done. When ECG was done, it was found the case of heart attack. And that gave us little bad feeling in our chest. We have admitted a case of heart attack with a chest pain. And we took opinion of cardiologist. He said there is a heart attack, but patient is stable. So with this we came to ischemic heart disease that ECG tells. Then we took echocardiogram which also tells ischemic heart disease. Then this treatment we continued for 7 days. And after 7 days another ECG was done. Myocardial infarction resolved. So this is one good case of concomitant. This is pathological general. Case of gynecomastia with testosterone very less. So you can see the testosterone level 3.19 and symptoms are sweats easily. He eats a lot. His totality was obesity. See, this is pathological general. Constitution, scrofulo-lymphatic constitution. Boger has given 9 type of constitution. So if you find during case taking any of the constitution matching with the patient, take as a rubric and you will find the correct remedy. So this is the things taken. And what medicine is coming is calcarea carb. He was given Calcarea cup 30 once a week. Report after 3 months. Libido has increased and the size of breast also has decreased. Testosterone report has become normal. See, this is 488. One more case I have to present. Okay, this case I will present with your permission, and after that I will close. This is diagnostic rubric. Here we do not have much of the symptoms, but we had a diagnosis of liver abscess. Very serious case, but the patient did not want to undergo any kind of operation. And their family is having a lot of trust in homeopathy, and their whole family takes treatment with us since long time. So they came with a report of liver abscess, advice for admission. And they said, something can you do, because I don't want to undergo opening of abdomen and treatment of mine. We said, yes, we can do that, but every week you have to take ultrasound and liver function test. And when the things are not better, you have to take responsibility and go for operation. He was agreed. If it is not improving, then we'll go for. And he was very faithful. Let me say, he was very faithful Muslim. He said, "You treat, Allah will heal me. You don't worry, doctor." We took up that case of liver abscess. And see, the liver abscess is 7 into 5.9 centimeter. This is the ultrasound. Liver abscess with early area of tissue breakdown. Not good sign. So with this report he has come. And we have a hospital there. Patient was advised to admit, but he came with that report only. I don't want admission. We have taken the case. We didn't find much indication. So we have taken rubric liver hypochondrium as a location, abscess hypochondria as a diagnostic rubric, bitter taste in the mouth as a concomitant, though it may be a common symptom in liver, but that was very prominent. Sweat on the forehead as a concomitant, constipation as a concomitant. These are not very strong concomitants, because maybe some of the liver patients can have bitter taste, can have constipation. So we found lachesis, silicea and bryonia. But with the differentiation we don't have much time. We have given silicea 30 once a week, empty stomach, and we advised to come after 10 days with the ultrasound. Not much change. Irregular hypoechoic lesion in the right lobe of liver, suggestive of liver abscess. But there is 0.1 reduction in the size. Symptoms were same. So 7.1 into 5.9. It was 5.9. Now it is 5.8. But patient says, I am feeling better. We gave tivoquinone 1m as an intercurrent, because when things are not improving, in spite of indication, you can give intercurrent. Silicea 30 once a week in the morning, empty stomach for 15 days. Again, after 15 days, do the report. What is the report? Resolving abscess in the right lobe of liver. This gave us a lot of relief. Then we continued. Size has come down. Silicea 200 once a week. And again, ultrasound. Liver is normal in size. No focal mass lesion detected. And completely healed abscess. Liver function tests were done. Everything normal. Normal abscess resolved. Advised to stop medicine. Patient overall was better, but has little flatulence. He was asked to discontinue the treatment. I won't present any case because I am forbidden by them. Now what I am telling is, see your effort and trying to find out the totality is very important. Second thing is, patient's also determination and faith in you is very important. How faith and determination comes in patient is written by Kent. Kent lectures of philosophy, if you read last incurable case, he writes, patient faith makes a physician to work hard because he tells, doctor, I am not going anywhere. You do whatever you want to do and you only give me the medicine. This what will do to you? It will make you more and more worried about the patient, what to do, more conscious about your profession, more conscious about your responsibility, your determination to make him all right, and you will work hard. You will refer more literatures, you will refer more books, more methodology, more philosophy, and you will come with a concrete methodology to treat the patient. This will make you a perfect physician. So it's vice versa. You make the patient better, patient makes you more and more confident. This cycle has to continue. How it has to continue? Because of your knowledge, your way of behaving with the patient, your way of treating, your knowledge of mathematics, your knowledge of repertory and methodology. So be a perfect physician to have all this. All the best to you. Work hard. This is the only key to the successful homeopathic physician. Thank you very much.
Thank you. Thank you, Dr. Tiwari, for wonderful presentation.
We had some more cases, but I don't have time. See, this is one case of fibroid where it's a very big fibroid. And patient came asking whether fibroid can be treated, and she became pregnant and she became all right. Only location sensation were taken. That's it.
Thank you very much, sir, for your excellent presentation. Now I invite Dr. Tanveer Hussain, sir, National President, Indian Institute of Homeopathic Physicians, and also Dr. Shivamurthy Garu, Vice President, South Zone.
Dr. Gupta. Dr. A.K. Gupta.
Yeah, South Zone, and also Dr. V.K. Gupta, sir, to come onto the dais to felicitate Dr. Shashikant Tiwari, sir. Sir, it's a great honor to felicitate Dr. Tiwari, sir. Please.
You call Dr. Best Serving Principal, the Director, Indian Homeopathic College, 31 years with continuous principal and the Director.
As a homeopathic principal for 40 years continuously. See their enthusiasm, tireless work for homeopathy. I request him to come on to the dais for the felicitation. Dr. Ravindra Kochar, sir. Please come, sir. Please come. Dr. Ravindra Kochar, sir. Please come on to the dais. I request Dr. Tanveer Hussain, sir, and also M.A. Rao, sir, to come on to the dais for felicitation. Vice President of Iihp National Central, Dr. K.S.S. Shivamurthy Garu, Dr. Geeta Mongia, Dr. Rajendra Singh, and Dr. Harish Daurat from UP. So I request them to come onto the dais for felicitation. I request Dr. M.A. Rao sir also to come onto the dais. I request Dr. M.N. Razu, President Iihp Telangana, to come onto the dais. I request Dr. Samyuddin sir also to come onto the dais. I request Dr. Srinivas Murthy to come onto the dais. Dr. K. Shivamurthy from Eluru, Andhra Pradesh. He is the Vice President, Iihp National, Southeast. I request Dr. Sudhanshu Arya sir, Secretary General, Iihp National, to come onto the dais. Please be active. Don't be drowsy. Should be crazy. Dr. Geeta Mongia ma'am. Dr. Hari Prakash Sharma. Dr. Hari Prakash Sharma sir, requested to come onto the dais for felicitation. Please, please. We are honoring senior goalkeepers from all over India. See their energy. So after next sessions, I request Dr. Tanvir sir, M.N. Raju sir, Manik Prabhu sir, to felicitate Dr. Renuka. Thank you so much, ma'am. College to come onto the dais for felicitation. I request Dr. Gayatri Madam to come onto the dais for felicitation. On behalf of Principal Dr. Venkateshwara sir, sir is receiving this memento.
and he had a PhD from University of Cyberjaya, Malaysia. And he has done a wonderful job and presented very important purpose in many international conferences. I would like to welcome Dr. Rafai. Thank you, sir. Please come.
Respected Chairman, respected Dr. Naveen Pavaskar sir, respected Dr. Sayyid Tanveer Hussain, the President of Iihp, my dear friends and colleagues, and especially students. I passed out in 1996 from Surat. I finished my internship training by 1997. For 1 year and a half, I did my house post in various other hospitals. Thereafter, I had joined ICR in Mumbai for another 1.5 years. And then in the end of 1999, I came back to Surat, the place from where I belong to, and I started my practice. I have taken few cases from the initial years of my practice. These cases actually scared me because it was not that I was not unaware of that homeopaths were treating such cases, but whether I would be able to treat such cases were the challenges. The reason was also very simple. My father was from the first batch of MBBS doctor from Surat Government Medical College. So in 1999, almost all the doctors who were there, they knew my father and they looked up to him. So many MD physicians and super specialists, they always referred their patients to him initially, just for his opinion. And not only that, when I came back from Bombay, my father promoted me that he is an upcoming homeopath and he has been trained in the prestigious Institute of Clinical Research. So you better send your patients to him. And initially this was, I don't know whether it was a blessing or a boon or a bane, I don't know. But when I started, no patients came. So I was just listening and suddenly it was in the midst of Ides of March of 2001 that I got a phone call. I got a phone call from one of the prominent neurologists who respected my father. And he said that, Zamir, I'm referring a lady having PSP. As if I should know what PSP is. So I said, okay sir, thank you very much. And he said, acha, apna jadoo dikha dena. And I said, what jadoo? Am I a magician or what? So, it was kind of a pressure that was building on me. तो उस वक्त वैसे तो कोई पेशेंट थे नहीं, बट आई सेड सर आई एम वेरी बिजी बिकॉज आई हैड टू नो व्हाट पीएसपी इज. उसने तो वर्ड बोल दिया पीएसपी, बट आई डोंट नो व्हाट पीएसपी इज. And he said, okay, sir, I'm very busy right now, so can you ask the patient to come to me after 4 days? And he said, okay, fine, not an issue. So ultimately, I got the patient after 4 days. And during those 4 days, I read out what PSP is. PSP meant progressive supranuclear palsy. Being a student of English medium, I knew what progressive was. I also knew what palsy was. But supra and infra nuclear, I never knew. So I had to actually go to various books and read about supranuclear palsy and what homeopathy can do about that. So this was a major thing. Anyway, after 4 days, this 67-year-old lady, she came taking baby steps into my clinic. She was being helped by 2 daughters on both the sides. They were holding her hand और इस तरह से उसको लेते हुए आए. The date of consultation was on 19th March 2001. And they came. She was taking baby steps. There was a twitching of orofacial muscles. The speech was inarticulate. Jumbled speeches was there. And she is already a known case of type 2 diabetes mellitus, hypothyroidism, and high blood pressure. And she is already taking treatment for all these medications, conventional medications. So this was a thing with which, and I had read that PSP means that there is a progressive disease in which some part of your brain, especially those part which controls your voluntary movement, motor movements, they are going into degenerations. It's a very rapid progressive decline, and the life expectancy of such patients usually is about 5 to 6 years. And then the patient slowly declines. They are unable to talk, they are unable to walk, they are unable to do any activities. There is constipation, they are unable to swallow, and slowly the patient dies. So there was no treatment for such condition. So I knew that this is the thing, and on top of that, she was already having all these problems. So with this thing, and I was on the line of fire because this patient was referred by a prominent neurologist, and I knew very well that he would be keeping me in focus that how I treat this patient. Okay, so the pressure was building upon me. The symptoms and signs, they had increased since 2 months. There was difficulty in balance while walking, even while standing. They were started with abrupt falling, buckling of foot. There was slurred speech, visual disturbances were there, and there was dysphagia. The diagnosis we all know of the current condition. We took the case, mainly the case was being shown, it was shared by the daughters. And what they said about their mother is that the father is into construction business, and mother and father, they both share a good IPR, interpersonal relationship. Initially, they had a joint family. Now the family is nuclear. She had 2 daughters and 1 son. She is a very strict and a disciplinarian woman. Now, the moment she entered the clinic, my clinic, and the type of baby steps that she was taking, I knew from, vibes aate hain na, कि there is a line of Urdu came in my mind that खंडर बता रहे हैं इमारत अजीम थी. Ruins proclaim that the building was once beautiful. That now she is very much, she has been absolutely into an handicapped state. But if at one point of time she was a very stately lady, and that is what my doubt was confirmed by the daughters, that during her prime, she was a very strict and a disciplinarian mother. She was a very efficient homemaker. She was time bound with penchant for perfection. And if any relatives or somebody else would come, any neighbors or something, she was very jocular. Very, she would laugh and she would talk with them very well. But with her daughters, she was very strict and a disciplinarian. The problem initially started when her son got married. She had brought the daughter from Bombay. She was a rich Bombayite. She was belonging to a nuclear family. So there was a mother-in-law and daughter-in-law tiffs, on household chores that was being taken care of. The first separation took place in 1990 when the daughter-in-law said that I am unable to stay with you. So I want separation. And this is the reason she was shocked, depressed, and she was really angry. Okay? Because she was greatly attached with the grandson. This was the first separation. Then in 1995, her own mother died. And at that time, she was not able to visit her mother during her end days. So this was another major shock and regret. Then in 1999, after 1995, when her mother died, the son again came back and they said, okay, fine, let us start to lay. The second separation came back again in 1999. Thereafter, the son started a business in which he had a great a failure. So the daughter-in-law said, let us again go back and reunite. But this time, to reunite, this patient was a bit anxious. Okay, now I have learned to live without my daughter-in-law, and now she's coming back to my house to stay. How would it be? So this was another case of anxiety. If you put it into this BPS model, biopsychosocial model, then this is how it would be kind of looking to. Let us just skip all this thing. So this is the understanding. Causticum was prescribed with great trepidation that what would be the end of it. From 30, 3 packets to 200 single packet. This was the remedy response. Balance, she was able to walk with stick for short distance and walk for longer distance with a walker. Comprehensive speech, improvement was more than 70% from the time she became first inarticulate. She couldn't achieve the type of speech that she had initially, but from the time that she became inarticulate, to the time when she came to me, it was 70% better. Dysphagia was also better. She was able to chew and swallow. HbA1c, there was no change of any medications, but it was around 7.4, 7.5. It came down to 6.5. TSH remained at the level of 2.2 to 3. And her BP were also maintained without any change of medications. This patient survived for another 10 years. Now, very rarely, if you see the books, very rarely do patients survive for this long. The usual period is 6 to 7 years maximum. Very rarely the patient of PSP survived till 10 years. She survived for 10 years, and except for once antihypertensive drugs change, all the other things were remained the same. She had gone for vacation thrice in India and twice abroad. The quality of life had also improved, and ultimately she had accepted her daughter-in-law. This is another case of great pathological changes. Again, 2 months before that, I had received this patient. This is a 64-year-old male, which I had got. He's a diamond broker. He's a diagnosed case of diabetic retinopathy due to uncontrolled diabetes mellitus, essential hypertension, hypercholesterolemia, benign prostatic hypertrophy, multiple skin tags, and constipation. So you can understand the type of problems that we are having, where we are facing. He had come to me specifically for treatment of only this diabetic retinopathy. I want to see. This is the only thing. The family history, we went into a bit of a detail. All 3 brothers and 2 sisters have diabetes. Father is a patient of COPD and CA liver, in which he had died. Also leukoderma. He has 2 sisters, both having leukoderma. And this is his personal history. Now, this is the life history. The patient is the 4th among six siblings. Initially, they were staying in a remote village of Gujarat. He belongs to a very poor economical family. When he was in his 7th standard, he wanted 4 annas. At that time, annas, wo chalta tha, uska chalan tha. It was quite a big amount of money. So the school had demanded that bring 4 annas and we'll take you for a picnic. His father couldn't afford to give him 4 annas. And this was something which put him off. And he said, to hell with everything, I'm going to leave the school and start earning money. From the next day itself, he started working with a diamond broker. There was a guy, he needed help, so he joined him. Later on, he came to Surat and he became a diamond broker himself, because Surat at that time was coming up as a diamond hub. He came to Surat and he became a diamond broker. He thought himself as an Arjuna with his aim solely on earning money. He educated all his brothers and their children. This is what he was saying. That's why they are in the inverted comma. He spent money on father's treatment because he was suffering from CA liver. So it was a lot of money that he needed. And in any event at the house, whether it was a kind of any baby shower or engagement or marriage or birthday celebrations or anything, he always used to give a lion's share. And he settled all his brothers abroad strategically. One of the brother he settled in Africa because that was the time. That is the place from where the diamond mines are there, and another brother in Antwerp, where all this business being taken care of. During the life space, the mental symptoms that came up was that he is always a very difficult man to get along with. The reason is that that is why he's a loner. The reason why he's a loner is because he's a braggart. He brags about a lot. One thing. Second thing, he wants importance. Anyone else being given importance in front of him, and he would not like it. He is very harsh in talks. He is very suspicious. किसी ने कुछ कह भी दिया है, कुछ भी करा, he would like to see what problem is there. He would never, first of all, he would always say that why that person is being nice to me. Whenever he meets any stranger or any person who's being nice to him, he would first of all question that why is he being nice to me? Is it because he wants something from me? What can he take things from me? These were the thoughts that would first of all cross his mind, and this is what he told me. I don't trust anyone so very easily. Haughty, inflated ego, manipulative, arrogant. Manipulative in the sense that he said that he doesn't know any other language except Gujarati, and yet he has visited more than 20 countries for his business. He is being a businessman, he has to be very manipulative, and he is very manipulative in that sense. He is irascible, right-sided, craving for sweets and hot. There was a difference between Lachesis and Lyco. Ultimately, Lycopodium I had given him, and this is the response that I got again. From 16-1, the day he came to me, Thuja 200 fortnightly were being given. Lycopodium was started from 30 weekly 3 doses, daily HS, and 200 weekly 4 doses were being given. This is the response. Right eye vision better by 40 to 50%, and right eye clouds were less. His PP2BS came down from 380, which used to remain around 380, to 170. His FBAs came down from 274 to 103. The insulin also came down from 25 international units to 12 international units. HbA1c from 9.5 to 7.4, that was a drastic change. And the BP also remained fairly constant. We have some time? 5 minutes or? 12:10? Fine. Yeah, fine. So this is a third case. Now this case that came to me, the reason why it came to me was very simple. It was a bit funny also. The wife came to me, and the wife brought her husband. The husband was sitting outside. And what had happened was, there was an incidence. The incidence was, this patient, he's a patient of bipolar disorder, which I came later on, and he was in his manic phase. He was going from his shop to another place, and he was getting a bit late. And somehow or the other, the petrol in his bike got over. The bike stopped. So what he had to do? So suddenly, people complained. They brought him to the house and said that he was found to be behaving in a very, irresponsible manner. What irresponsible manner? The irresponsible manner was that he was found urinating in the tank of his bike, in public, on the road. And it was a very something, people just, his wife couldn't believe it. And she said, "Ke actually aisa hua hai?" Yes, it is. He was found urinating in the tank of his bike in the in front of public on the road in broad daylight. Then started कि भाई क्या हुआ? The problem is, this lady brought her husband, 40 years of age. He is a businessman. He belongs to middle class socio-economic family. Husband is not doing any work right now. He sits at home brooding since past 15 days. This thing happened 15 days back. There was a history of previous such behaviors. Hyperactivity phase, that is what the wife said, that there is some short period जब ये बहुत ज़्यादा उत्तेजित हो जाते हैं. That is what she said. So hyperactivity phase was also intermingled. He is taking some hypertensive medicine and mood elevator and lithium carb. I asked the patient to come in, and he sat with a very impassive face. No emotions, no expressions. His face was unwashed, it was dirty, it looked a bit older, unshaven, unwashed. There was a slight smell that was coming, and he was wearing his night dress. He sat like a stone. There was no reaction to any question. Fixed, depressed expression was there. Okay. I had to again ask him to go and sit outside, bring the wife in, and then question the wife that what exactly has happened. So the wife's interview was that husband is a cloth merchant or was a cloth merchant. He had repeated mood swings. He was easily affected by market fluctuations, and he could not sustain the strain or loss of customers, which led to loss of customers, and there was a heavy financial loss. So he became a broker, and he worked at somebody else's house. Somebody else's shop. Hypomanic and manic phases, manic and depressed phase were intermingled. And this is what it is. Whenever he was in his hypomanic or manic phase, he would talk of restarting his business. And whenever he was in his depressed phase, he became asocial. Not only asocial, the sleep was less, talk was more, and the sexuality was less. And during hypomanic and manic phase, the sexuality was more, the sleep was less. This was the thing. There have been up till now 3 to 4 attacks of hypomanic or manic phase and about 6 to 7 attacks of depressed phase since 1993 post riots. He had been shown to psychiatrists, Ayurveds, homeopaths, spiritual healers, and quackery was there. Everything was there. Amulets, holy water, etc. They all have been tried to no avail. And this is the difference between the two parts. Once, whenever he is in a depressed phase, he would stay in night dress for days together, feels he is being charmed and under evil influence. There is no desire for any activity, including sex, hardly would talk, and sleep would increase. And if he would be in his hypomanic or manic state, he would hardly sleep. There was continuous talking of various things, restarting his business, etc. Easy distractibility. He would jump from one topic to the other. He would increase in sexuality, and there were goal dialectic. I want to do this, I want to do that. It was only during this phase that his boss, the place where he was working as a broker, his boss has asked him to go and deliver some message to another shop. And he also told him that take this money and there is a less petrol. So you just go over there and fill up the petrol first and then go to the shop. But he was in a hurry. He was in his hypomanic or manic phase. So he disregarded the advice of filling the tank first. He just went over there, and in between the petrol got over. So later on I asked him that why you did that when he was in a bit better with our medication, and he said that I had seen a movie. In that movie, Sunny Deol was there, and he had, in that movie it was that somehow he peed in his petrol tank and the car started. So he remembered that shot, and he said that actually it is true. So he did that in front of the entire people in broad daylight on the road. This was the thing which brought him to us. As a patient, as a person, he is hot, aversion to milk, desire for non-veg and stimulants, sun aggravation, headache, and BP. This was the thing. He was given Lecasis 200, one dose weekly to three doses weekly, and to 1 m, one dose weekly. TUB was given during manic phase, and Thuja was given during depressed phase. Medicine continues in increasing potency. There was no manic or hypomanic phase during 6 months, during which time he was with us. No attack. There was just one attack of depression. Intensity was also moderate and duration was 10 days. Previously, it used to remain for months together. It was only for 10 days and it was covered with natrum sulf at that time. And the work attendance also improved. For 2 years, there was no contact. And then he referred one patient. One patient came to me and I asked him that who had sent you? And he said, this guy had sent me. So I said, okay, he's here. Well, yeah, he's here and he wants to talk to you. So there was a phone call and I just talked to him and he said that he has started a chocolate factory. Now that chocolate factory is one of the most largest outlet showroom on the Surat-Vadodara highway. I never knew that this chocolate factory showroom has been started by him. And he started that and he said that, sir, please come over there. And so this is how our medications act. And the last case, by 2004, my fame in the local area had spread. I was also attached with the college. So one of my students, she referred another case to me of skin disorder. This is called as plantar psoriasis. You have seen this? This is, and she sent a few pictures. Now at that time there was no mobile, there was no WhatsApp whatsoever. So these were all pictures that she had sent me through email. The pictures were being taken care by SLR camera. This 15 years male, 10th standard student, vegetarian, staying in Ranchi. Now this case, I have never met him. I have never seen him. I have never interacted with him. Entire case was on telephone. There was itching, deep cracks, mildly obese, perspiration was excessive, offensive, flatulence, dentitional diarrhea was there. The mother's obstetric history was that the patient's mother had done, she was a Gujarati and she married a Bihari guy. So she was, not being accepted in the family. The only thing was that the brother, that is the patient's mama, he was still on talking terms with her sister, and this is the reason why they were being referred to me. Anger comes suddenly and goes suddenly, mainly on silly matters like mother has not pampered his favorite dish or whatever it is. It was mostly a calcarea picture that was there, and that is what it is. We went to it. This is the thermal state. The thermal state was hot. Calcarea, hot patient, skin infection. We went away with, we went with calcarea self. This was the calcarea self. You can see the first, we gave it for 4 weeks because the medicines were being sent to Ranchi. And second time, only 2 doses were being given and then he had developed an aggravation. So we stopped. And from that time onwards, it was only stopped, he was only on SL. So if you see this, during the case taking, this was the case. After 1 month, after 2 months, after 4 months, after 6 months, with SL. And now, if you want to see the food, this was during case definition. During case definition, after 1 month, after 2 months, after 4 months, after 6 months, and this is it. Thank you very much.